The dorsal scapular nerve pierces which muscle during its course? Answer is option B, scalenus medius. The nerve usually pierces the middle scalene muscle, making it susceptible to entrapment. MRI shows a cystic mass in the suprasellar region with calcification. What is the most likely diagnosis? Answer is option B, craniopharyngioma. When you see a cystic lesion in the suprasellar region with calcification, the first diagnosis to think of is craniopharyngioma. This combination is a classic imaging clue that frequently tested. Which mosquito spreads the Zika virus? Answer is option A, Aedes aegypti. The same mosquito also transmits dengue, chikungunya and yellow fever, making it an important one to remember. A 35-year-old HIV positive patient has white patches in the mouth. Microscopy shows budding yeast cells with pseudohyphae. What is the most likely diagnosis? Right answer is option D, oral candidiasis. Budding yeast with pseudohyphae is the hallmark of candida infection. In a HIV patient with oral white patches, think oral candidiasis first. In fetal circulation, which blood vessel carries deoxygenated blood from the baby back to the placenta? Right answer is option C, umbilical artery. Two umbilical arteries carry deoxygenated blood from the fetus to the placenta, while the single umbilical vein brings oxygenated blood back to the fetus. Always remember, vein brings, arteries return. A 10-year-old boy presents with seizures. He had a fever with a rash at 1 year of age that resolved on its own. Which investigation is most helpful to confirm the diagnosis? Right answer is option A, measles immunoglobulin G antibody in CSF. A child with seizures years after a measles infection should make you think of subacute sclerosing panencephalitis. The diagnosis is confirmed by high measles immunoglobulin levels in the CSF. Which thermometer is specifically used to measure low air velocity rather than the cooling power of air? Right answer is option D, Carter thermometer. The Carter thermometer is used to measure low air velocity. It's especially useful for assessing ventilation in indoor environments. An outbreak of painful swollen lymph nodes is reported in a community. Which vector is responsible for spreading this disease? Right answer is option D, Synopsila chiopis. Buboes are a classical feature of plague. The disease is transmitted by the rat flea Synopsila chiopsis, which spreads the bacteria from infected rodents to humans. A 27-year-old woman is diagnosed with uterus didelphys. Which of the following is least likely to occur as a complication? Right answer is option C, transverse lie. Uterus didelphys commonly increases the risk of miscarriage and preterm birth. Transverse lie is least commonly seen, making it the least likely complication among these options. A man eats a fruit while playing in a garden. Soon after, he develops irritability, restlessness, hard dry skin, and is unable to pass urine or stools. Which poison is the most likely cause and what is the correct antidote? Here the right answer is option A, Datura physostigmine. Hot, dry skin, urinary retention and constipation are classic signs of Datura poisoning which causes anticholinergic toxicity. The specific antidote is physostigmine.